Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. It's September 26, 2024. Today we will be speaking with NCQA's Chief Growth Officer, Brad Ryan, to talk about data quality and digital transformation. Before we begin, I wanted to highlight that Health Affairs released an ahead of print article this week. It's from Jillian Steelfisher and colleagues, and the article is titled, "A Majority of Americans Have No or Low Awareness of Paxlovid, the at-home COVID-19 treatment." It'll be published in our October issue, but you can read it online right now. So today on the program, we have NCQA's Brad Ryan. Brad, welcome to the show.
Thanks so much for having me. Excited to have this conversation.
Yeah, thanks for joining. So one of the things that we talked about before we began recording is digital transformation and what health systems can do or think about their digital transformation. But before we get into that, one of the things I thought of is data quality. So first you have to have the data and have it be quality to be used. So can you set the scene for us? What is data quality like in the healthcare and health providers landscape now? Is it even possible to be standardized, especially as tech evolves?
It's a great question. It's maybe one of the most important questions that we should be asking ourselves when we think about policy and technology investments in healthcare. First, I'll say we've made great strides in the last 10 to 15 years in digitizing the collection of healthcare data. So the adoption of electronic health records and the work that has been done by so many to start using that information to drive applications like population health and quality measurement and similar. We've made a lot of progress from manila folders and paper files to digitizing that data. But we are, for all the digitization, we have no standardization yet. What we have now are policies that require standardization of data, clinical data, to be shared for purposes like quality measurement or risk adjustment or prior authorizations, but it's not really implemented. And that's the challenge around data quality, is we have a lack of a common framework for assessing the quality of data so that two organizations or more than two organizations can trust the data that they're sharing one to the other. Every company that does data integration, in some form, there's lots of these data companies, they all have their version of data quality, what they do to ensure that they think the data is good, but there's not a common understanding between organizations. So very common is the situation where two organizations trying to, say, enter into a value-based contract or talk about population health will disagree on the data that one organization is trying to share with the other. So the bottom line answer to your question is we have a lot more data than we've ever had, but we don't have that data quality framework that lets us agree that the data can be trusted.
Do you have a sense of if we might ever have that where everyone's kind of working from the same playbook? I just immediately think of, will we just have regional agreements, or is it just business partnerships?
There's a lot of reason to believe that we can get there, and it'll be a journey. Let me give you a few of the data points. First is frameworks like TEFCA. TEFCA is the Trusted Exchange Framework and Common Agreement. That's a policy that was driven out of the 21st Century Cures Act a few years back and is now coming into implementation. And that's really sets some of the foundation for being able to share data readily for certain purposes between organizations, where the whole idea of this common agreement is that you don't have one by one business associate or regional agreements, but you have a national framework for how organizations can share data with one another and what's expected to be shared. So that's important. It's sort of necessary, but not sufficient in this case. Then what you need, once you have a mechanism to enable sharing between any organization, not just one by one, then you need to be able to assess the data quality. And what we've what we've got are a couple of use cases where data quality has been assessed. And one of those use cases is HEDIS. HEDIS is an NCQA product. And HEDIS reporting is one of the tips of the spear, I would say, in clinical data quality because we audit that data. There's a manual process by which all health plans that report on HEDIS measures get that data audited on an annual basis. Now, that's not the future solution here because that's a manual process. It's a fairly burdensome process. And now NCQA is taking steps to try to relieve some of that burden through what we call our data aggregator validation program, where we validate data upstream from the health plans and earlier in the cycle. But we can do much better as an industry at validating data for multiple use cases, not just for HEDIS reporting, and by using technology and not just human auditors. So now is the time, in my opinion, to take advantage of, one, the standards that are available and driven by policy for data exchange. So that's HL7 FHIR, Fast Health Interoperability Resources. That's a standard that's required by CMS and ONC, or what's the new acronym for ONC? I forget.
We know
there's a policy requirement to share clinical data in a standard form. There's an exchange framework and a common agreement to share data between organizations in TEFCA. And now we need that common assessment of data quality to sit on top of that so that organizations can trust the data.
Thanks for walking us through that. So you set the stage with some pretty optimistic opinions on that, which is fantastic. One of the things makes me think about is whether providers even care about this sometimes, or about this data standardizations, especially like I know maybe it's an old school way of thinking of like my data is my data. That's not your data because that's my patient, not your patient. Is this something that providers are even excited about? So that's like one part of the question. And then the second part of the question is, to your point, EHRs, I think, have been largely adopted, which is fantastic. So we have digitized a lot of data, but how are providers thinking about new tech startups that are creating new data to then infiltrate or be added onto a data layer that's already quite vast?
Yeah, they're both good questions. I'll start with why should providers care, or why do providers care? The main reason that providers should care about clinical data quality is they would like to be reimbursed based on the quality of the care, the service that they're providing, and not just on the volume of services provided. That's value-based care. That's moving from fee-for-service towards something that's value-based. And almost uniformly, providers will say, I think I deliver good care to my patients and I'd like to be rewarded for that and not just feel like I'm on a hamster wheel of having to do more things. And so that's the reason for providers to care about this, is that this is the way to get compensated for the quality of care that's being delivered. Now, why do they hate this? It's fair to say that providers are burning out at historic rates because of administrative burden that's put on them to capture data like this, clinical data, charting and recording and coding all the things they do, all the diagnoses that their patients have. That burnout is based on the fact that this is a manual and non-standardized data capture process. So providers should care because, one, they want to be reimbursed for the quality of care that they provide. And two, they are hugely frustrated by the administrative burdens of capturing even a small amount of this data in a manual way. So what we ought to be thinking about is how we capture the right data in the same way in all these digital systems, these EHRs, as exhaust from providing care, as a byproduct of providing care. And that gets me to your second part of your question. how should providers think about new entrants into this market? Whether we are capturing data in the electronic health record and asking the EHR vendor to help map it to a standard that we can output so that it's standard, or whether we're capturing data in a new way, let's say an ambient AI solution that's listening to a provider patient conversation and helping document it, we give a common target to all the technologies that says, hey, here's the information we're trying to capture as an industry that helps us know something about the quality of care that's being delivered, the risk of the patient population that's being cared for, appropriateness of care for things like prior authorizations and utilization management. We give a single target to all the technology providers. That is the goal of the standards that are coming out of CMS and other organizations like NCQA, to say, let's have one target for the data that we want to collect so that everybody knows what it is. Everybody's aiming at that same target. And then as we want to add things to it, as innovation happens, as we start to collect data from more and more sources, let's just evolve that roadmap and let's have a single roadmap as an industry rather than figuring out how to use data from all these different sources in different ways. Let's have one target.
So, and maybe we'll cut this out. Maybe we'll leave it in, depending on your response. But something that, as we were talking, this made me think about. So, the news this week that Particle Health sued Epic Health, alleging monopolistic practices regarding data, I think can touch on to what we're talking about. And I didn't know that Particle Health was started in 2018, which I thought was interesting because, as you noted, this is digitization of healthcare data has been around for quite some time. So to see a new entrant was interesting to me. But it also gets into the competitive aspects of data. Is there any way that you see that story? And I haven't read the 81-page lawsuit, so not super into the details with it, but when you see that story, how do you think about data standardization?
This is a great question, and it's part of what you asked earlier that I didn't directly respond to is, who does this data belong to? Is it a provider's data because it's their practice? Is it an EHR's data because they're the health record? I think there's some amount of consensus in the industry among at least policymakers that it really should be the patient's data, a person's data about themselves. And things like the information blocking rule from a few years back were explicitly targeted at trying to discourage the sort of the walled garden data strategy, or monetizing data inappropriately by organizations like electronic health records. Now, the other side of the spectrum is privacy and security. And those are absolutely valid aims. But I feel sometimes privacy and security are used as rationalization for withholding data or charging for data that should be free flowing. If it's in a patient's best interest or a patient's desire for data to be shared about their healthcare, about their health from organization to organization, that should be allowed to happen freely. And that's what information blocking is, explicitly an example of policy to try to encourage that and discourage the unnecessary withholding of data or protection of data.
Kind of moving forward with that. So let's take that there's this that we'll move forward with, hopefully some standards and quality standards. Why is this important? So when we look to digital transformation, it's happening. It's been happening in a lot of industries. We know healthcare is behind a lot when it comes to the technology adoption. Why is this important?
Boy, well, this is a place where I personally have a lot of passion and have really oriented my career around this question. So it's very, very important to me, and I think it should be important to most. I think that the idea of digital transformation in healthcare centers around not just the digital part of it, but it centers around changing the framework for how we pay for and evaluate healthcare services. And we have traditionally reinforced fragmentation. So there's any number of folks who will tell you one of the biggest problems in US healthcare is fragmentation. Every individual player is optimizing for their own outcome, and they're not doing anything wrong. That's just the framework that we've created. What digital transformation enables is us to start thinking of it more as a team sport, where the center of that focus becomes people and populations of patients that need good care, and not, the center of our focus being a health plan or a provider practice, because multiple providers are taking care of patients, and depending on conditions and risks, there's a team of clinical and non-clinical resources that need to provide care in a different way. So what digital allows us to do is sort of disconnect that tight connection between the organization and the healthcare organization, like a provider practice or a health plan, and reorient around patients and populations wherever they may go to get care and services. And that, to me, is the powerful and profound impact of digital transformation in healthcare. Is imagine that healthcare works like consumer retail, where information about who I am and what I buy and how I like to receive it and where I receive it and how I pay for it, it follows me wherever I go. Imagine if that happened in healthcare. Imagine if your care plan followed you from provider to provider or provider to administrative, service that you're being provided by a health plan. And that's the really powerful, profound impact of digital transformation in healthcare, is to be able to orient around people the way that we do in other industries like retail and finance and others.
We are about to draw our conversation to a close. But before we do, kind of wanted to get your sense of, like, for people that aren't steeped in health IT or health information exchange or things along those lines, what do you see as being, I don't want to say trends, but like, what do you see the big picture of what they should be paying attention to in regards of, like, if there's I don't want to say groundswell, but if there's a tipping point, maybe that's too strong of a word too, but like, how might we notice some digital transformation change in the next couple of years?
One of the first things that any individual can do is take charge of their own health data. There are policies now that require patient access APIs, which means an API, just an application programming interface. An API is what we use anytime we use an app to connect to our bank or our retail store or whatever. There are now requirements that patients be able to access their data and use applications that sit on their data, but people don't know about it and they don't take advantage of it. And they think, oh, I have to go to my doctor's office to get, information about my healthcare. So I think even at an individual level, we can start to take ownership of our data and the ways that we want it to be used and the ways we want to use it, that we haven't done in mass and at scale to date. So there's one. I think the second sort of trend that I would look at is value-based care is having a moment where there are now care delivery models that didn't exist previously. So think of diabetics, people that are diagnosed with diabetes. They used to have a primary care physician plus or minus an endocrinologist that managed that chronic condition. And that was the only care delivery model. Now we have companies with armies of clinical and non-clinical resources that can align against helping prevent and reduce the risk in a diabetic population. Finding and seeking out those new care delivery models also leads consumers, individuals that may not be, in the middle of all this tech and interoperability conversation, it leads them towards value-based care because those organizations are seeking to be compensated on the outcomes that they provide for those populations, not on the fee-for-service model. And so, it's not to say that all of those organizations are good or doing a great job, but there's a reorientation of the care delivery model that leverages this data sharing that we've been talking about and leverages value-based payment that says, hey, we're going to try to compensate based on the results that we get for this patient population that we're attributing to you or that we're aligning these care delivery models to. And that, I think, is where we will catch a wave that will, drive more adoption of data sharing, clinical data quality, all these things we've been talking about today.
Brad, Ryan, anything you want to plug from NCQA's perspective? Any resource or where they can find you?
Yeah, NCQA we're on a journey on digital in healthcare, and NCQA is one player in an ecosystem of players. But one of the things we try to do is convene around these topics and bring organizations together to have a conversation. So we have our digital community that we could link to part of this podcast. And we have multiple collaborations ongoing around evolving standards, such as our digital quality implementers community, our bulk fire data quality community, and others. So for organizations, anybody who's listening who wants to get involved, we have multiple ways to do so, and we could direct them through that digital community as a starting point.
Awesome. Brad, Ryan, thanks for joining us today on Health Affairs This Week. To you, the listener, thanks for joining us. If you enjoyed this episode, send it to the futurist in your life. And with that, feel free to subscribe, share this with a friend, and see you next week. Thanks, everyone.